Well, I speak on behalf of our 50,000 teammates that work at Humana, that we are thankful of being here and honored. The demo that you were describing just recently is an example of the strength of public-private partnerships and dealing with large issues such as the affordability of prescription drugs. And insulin is by far the one that is used the most. Another great example of that is the response to COVID and the crisis. And I think about one of our customers, Gwen, that just recently we served, that was blind, did not have access to food. No one could support her because no one was in the vicinity to help her. And in addition, didn't have access to her prescriptions. And through a strong private-public partnership, we were able to offer her food and prescriptions delivered to her home. So I want to thank the administration for continuing to pick on large issues like this and bringing in the private enterprise to assist in that. So thank you, Seema, and everything you've done. So thank you.
What a job you've done, too. Really an amazing job. And
thank you.
You're also in the right business, right?
Well, if we can help any senior, we're always in the right business.
That's good. That's good. Oh, you've really helped, and we appreciate it very much. Thank you, Bruce. We're also joined by Tracey Brown, the CEO of American Diabetes Association, and a lot of bad things can happen without insulin in terms of diabetes and other things. Please, Tracey. Thank you very much. Hi, Tracey.
Thank you, Mr. President. Thank you, Administrator Verma, for making this afternoon one that we can focus on the 34 million Americans like myself who's living with diabetes, 7 million of which need insulin to live. 25% of these individuals have told us that they ration or skip doses of their medicine because they simply cannot afford it. And so this effort, CMI, MMI demonstration project that brings together the government, industry, and public health advocacy from the American Diabetes Association is the right thing to do, and we're thrilled to take this challenge head on. Today, together, we are helping millions of seniors access insulin affordably. This is a very big deal. The American Diabetes Association is the nation's leading organization that fights for people living with diabetes, and we are committed to continue to partner to make sure every American, and especially our seniors, have access to the medicine that they need to live. So thank you, Mr. President, and thank you, Administrator Verma.
So, Tracey, are you surprised at how much we've gotten the price down, to what extent, and to the level that we brought it down to?
This is a very exciting day for people living with diabetes, and so any step to bring this lower is the good news. We know that we need to do more, but I'm so confident that together we're going to be able to help all people living with diabetes thrive.
Good. Thank you very much. Appreciate it, Tracey. I'd like to also invite up David Ricks, Chairman and CEO of Eli Lilly and Company. A very big and a very great company. Please, there's another young guy.
Thank you, Mr.
Thank
President.
you very much, David.
Pleasure to be here. Really an honor to be a part of this announcement to improve the lives of so many patients who live with diabetes in our Part D program. For several years, Lilly's worked hard to improve insulin affordability, and this has been a missing piece that's now been filled in by the great collaboration from our plan companies like Bruce's who are here, Seema Verma, your administration, Vice President Pence, President Trump. Thank you for your leadership to make this happen. This is the kind of collaboration that solves real problems for people with serious issues like diabetes. Today, if you take Lilly insulin, you will not pay more than $35 except for in the Part D program. And we're pleased to add this missing part to that equation so that starting next year, seniors will benefit from that same savings level, just a little bit more than $1 a day for insulin. That same spirit of collaboration is also being applied to collaboration around COVID-19. And I think everyone's aware that there's thousands of scientists working in our industry, along with NIH and other experts, to speed around the clock new therapies for patients suffering from COVID-19 and to arrest and extinguish this pandemic. I've never been more proud to be a part of that effort as well, and this same spirit of collaboration is being applied in that incredibly important crisis as well. Together, by working together, I think we proved today we can solve long-term problems, and I hope I can come back someday and show that we've solved the immediate problem of COVID-19 working as an industry along with government. So thanks for having me here today.
Good, and I think we will. Thank you very much. Thanks, David. Appreciate it.